Today I'm going to be talking about the importance of medical terminology in the nursing field. Knowing medical terminology is very important in the world of nursing. You have to be able to communicate all the signs and symptoms the patient is exhibiting to the doctor so that a diagnosis can be reached and a treatment can be started. Medical terminology also standardizes communication between all healthcare professionals to make it easier and faster to communicate different aspects of patient care. Let's say a patient came into the emergency room showing symptoms of a urinary tract infection, including fever, nausea, and hematuria, or blood in the urine. Upon assessment, you find out that the patient has a comorbidity of multiple sclerosis, which is a gradual degeneration of the joints and muscles, leaving the patient unable to urinate independently. The patient has in place a suprapubic catheter in the right iliac region of the abdomen to relieve the bladder. The UTI came from not cleaning the suprapubic catheter properly, which then allowed bacteria to enter and infect the patient. They were admitted to the hospital, and all of the previously mentioned information was communicated to the doctor using medical terminology. The doctor then orders a urinalysis to determine what bacteria caused the UTI, and a CBC to view the patient's blood workup. After analysis of both tests, it was determined that the bacteria present in the urine had caused the patient to become septic. The doctor ordered the patient to start the IV antibiotic ampicillin to treat the UTI and sepsis. As you can see, medical terminology is very important to understand when identifying and treating illnesses that patients may have and communicating it to other healthcare professionals as needed. And I also have a few illustrations. Okay. Here is the first one, and it just shows what a suprapubic catheter looks like. So the blue tube is going directly into the bladder to relieve any urine that may be stuck in there that the patient cannot avoid on their own, which is due to the multiple sclerosis seen in the patient. And then the next graphic is just some symptoms of a multiple sclerosis patient. It will affect their vision, their spinal cord, their senses. They may not be able to sense things very well on their hands and feet, their muscles, which would be their musculoskeletal, their urinary system, as seen with the UTI and the suprapubic catheter, their digestive system or gastrointestinal, their mouth, and their brain or neurological.
Within the last few weeks, this course has taught me a lot about medical terminology, including many medical terms and how to use and understand these terms. One aspect in particular that I have learned more about is the cardiovascular system. For example, a patient arrives at the emergency room complaining of a tight chest. After taking the patient's vital signs, including oxygen levels, blood pressure, and heart rate, it is determined that the patient is experiencing tachycardia, which is a rapid heart rate. Then, after conversing with the patient and collaborating with the cardiologist, it was determined that the patient had recently been dealing with a lot of stress and anxiety. To be on the safe side, the cardiologist suggested an EKG. The result of the EKG came back normal. The end result for the patient was being put on a form of nitrate, which is a drug that treats chest pain associated with chest tightness or squeezing.
Throughout this course, I have gained knowledge of medical terminology in a variety of body systems. One of the body systems that I have learned more medical terminology in is the gastrointestinal system. It is really important for us as healthcare professionals to understand this medical terminology so that we are able to properly communicate with our patients and fellow healthcare workers. For an example, a surgeon is paged into the emergency department to consult with a patient. The doctor on call in the emergency department explains to the surgeon that the patient has currently been experiencing nausea, vomiting, fever, and gastralgia. Immediately, the surgeon understands that the vomiting is most likely caused by the nausea. However, the surgeon questions why the patient is experiencing a fever and pain of the abdomen. The surgeon decides to order a barium swallow so that he can examine the esophagus, stomach, and small intestine for any abnormalities. As the test comes back, the surgeon can see that the patient's appendix is inflamed. Following the results of the test, the surgeon diagnoses the patient with appendicitis. Due to the diagnosis of appendicitis, the surgeon decides to order an appendectomy for the patient to remove the infected appendix. As seen here, with the knowledge of medical terminology, all vital information was able to be communicated properly.